Which of the following is the most accurate description of myelocystocele? A. A simple cyst containing only cerebrospinal fluid. B. A rare form of spina bifida where the central canal of the spinal cord is dilated and herniates through a posterior vertebral defect. C. A fatty tumor that does not involve the spinal cord. D. The presence of two separate spinal cords in one canal. Answer, B. A rare form of spina bifida where the central canal of the spinal cord is dilated and herniates through a posterior vertebral defect. A sacral agenesis, caudal regression syndrome, is most highly associated with which maternal condition? A. Maternal hypertension. B. Maternal pregestational diabetes. C. Maternal asthma. D. Maternal hypothyroidism. Answer, B. Maternal pregestational diabetes. In the management of neurogenic bladder, which of the following is an anticholinergic side effect that patients may experience? A. Excessive salivation. B. Diarrhea. C. Blurred vision and dry mouth. D. Slow heart rate. Answer, C. Blurred vision and dry mouth. What does the double bubble appearance on an MRI of the spine signify in a patient with diastematomyelia? A. Two separate bladders. B. Two hemichords within a single dural sac or two separate sacs. C. Two separate brainstems. D. Excessive fluid in the lungs. Answer, B. Two hemichords within a single dural sac or two separate sacs. Which of the following describes the syrinx progression in a child with a malfunctioning BP shunt? A. The syrinx will typically decrease in size. B. The syrinx may rapidly expand due to altered CSF pressure dynamics. C. The syrinx will turn into a tumor. D. There is no relationship between shunts and syrinxes. Answer, B. The syrinx may rapidly expand due to altered CSF pressure dynamics. Children with spina bifida often exhibit nonverbal learning disability, NVLD. Which of the following is a hallmark of NVLD? A. Excellent verbal memory but poor visual spatial and tactile processing. B. Inability to speak fluently. C. Superior math skills but poor reading skills. D. Loss of long-term memory. Answer, A. Excellent verbal memory but poor visual spatial and tactile processing. What is the primary clinical concern regarding cryptorchidism, undescended testes? In males with spina bifida? A. It is never seen in spina bifida. B. Increased risk of testicular malignancy and infertility. C. It causes the kidneys to fail. D. It leads to immediate heart failure. Answer, B. Increased risk of testicular malignancy and infertility. Which of the following is a common non-neurological association of spina bifida, particularly in the thoracic region? A. Polydactyly, extra fingers. B. Rib anomalies and fused ribs. C. Cleft palate. D. Mirror movements of the hands. Answer, B. Rib anomalies and fused ribs. The whirlpool sign on ultrasound of the abdomen in a spina bifida patient with a mastoma might indicate A. Normal digestion. B. Midgut volvulus, twisting of the bowel. C. The stoma is working perfectly. D. A kidney stone. Answer, B. Midgut volvulus, twisting of the bowel. Why is skin checking considered a critical daily task for adults with spina bifida? A. To check for new freckles. B. To detect early redness or pressure sores in areas with no sensation. C. To monitor for vitamin D absorption. D. To prevent the development of spina bifida occulta. Answer, B. To detect early redness or pressure sores in areas with no sensation. Which of the following gait patterns is most typical for a child with an L4 level myelomeningocele? A. Trendelenburg gait, due to weak hip abductors. B. Completely normal gait. C. High-stepping equine gait. D. Stiff-legged scissoring gait. Answer, A. Trendelenburg gait, due to weak hip abductors. What is the specific risk of silver nitrate or iodine-based cleaners when used on an open myelomeningocele sac? A. They are the best choice for cleaning. B. They can be neurotoxic to the exposed neural placode. C. They cause the baby to grow too fast. D. They improve nerve regeneration. Answer, B. They can be neurotoxic to the exposed neural placode. Which test is most useful for determining if a child with spina bifida is ready for bowel training? A. A blood test for folate. B. Assessment of anorectal manometry and the presence of the rectoanal inhibitory reflex. C. A hearing test. D. Measuring the child's height. Answer, B. Assessment of anorectal manometry and the presence of the rectoanal inhibitory reflex. Trophic changes in the lower extremities of spina bifida patients include A. Excessive muscle growth. B. Thin, shiny skin and poor wound healing. C. Increased bone density. D. Rapid nail growth. Answer, B. Thin, shiny skin and poor wound healing. What is the primary role of social work in the multidisciplinary spina bifida clinic? A. To perform the spinal surgery. B. To assist with school IEPs, individualized education programs, transition to adult care, and insurance navigation. C. To prescribe anticholinergic medications. D. To conduct MRI scans. Answer, B. To assist with school IEPs, individualized education programs, transition to adult care, and insurance navigation.